We'd like to invite everyone downtown Jackson this holiday season as the windows are decorated for the holidays and Christmas. And come down and you can vote. Pick your favorite storefront. Voting will end on December 1st. JTV is in the running. You don't have to vote for us, but we'd sure like it. And the winner will be announced on December 23rd. But please come down, visit all our local restaurants and shops. It's a great time downtown.
Our next guest actually was spotted doing a little window shopping recently downtown. The COO and interim CEO at the Center for Family Health, Sara Benedetto, and Chief Medical Officer, Dr. Rose Johnson. Good morning.
Good morning. Good to see you guys
Little
again.
window shopping.
Little window shopping,
Okay.
even on the way in.
All right.
Today I was like, oh, I need to get over there to Blessed Nest and
Oh yeah.
check it out again because it's changing. It looks
I
beautiful.
know. I know. It's amazing.
Yeah.
There's new stuff in there all the time.
You guys have some big news, breaking
Great
news.
We do. We do. We're really excited to announce that we are reopening our school health center at the Northwest Kidder Middle School.
Oh, that's a big deal.
And we open on Monday, the 12th of December.
So
very excited.
Wow. So with that back open, what will that allow the students at Northwest to utilize?
So we have a full-time therapist, Lindsay Good, that will be there, and also a nurse practitioner, Marie Glasgow, which many of our patients might know already from our walk-in.
Yes.
Yeah, she's excellent with the care that she provides, and patients really like her. We have primary care that students can access, vaccines, flu and COVID vaccines, all the childhood and adolescent vaccines, and then pretty much anything you would go to a doctor for. So it's like a doctor's office in the school. Again, it's open to everyone in the community, not just students. We have had a big following before the practitioner there retired.
Yeah, and that really has been the reason you just haven't been able to get people.
Yes, yeah. Unfortunately, it's the staffing resources but we are very excited. One of the medical assistants has worked there for several years, and she's still with us.
Nice.
She's just been working in other places, and she'll be heading back there.
Nice.
So,
I think the word of the month in healthcare is flu. Have we had it here yet?
yeah.
Yes, we have. We have actually seen quite a few flu cases in our walk-in clinic. So it is here. We definitely want everybody to get immunized against the flu. It helps protect from severe illness for sure. So we want everybody to get immunized against it.
So don't pay attention to that big map that you see, because you just don't know when flu's already here, do you?
That is correct. And also, especially for people who are immunocompromised, it could be very serious.
How about triple-demic?
Yes.
Flu, what's the
COVID.
other one?
RSV and COVID.
Yeah, we're seeing a lot of RSV as well.
Yeah, we've also seen a lot of RSV, and in RSV also, especially in little kids, it can end up being really serious. And if combined with flu, it could be worse.
Sara, we're not quite to the end of the year yet, but the center has served nearly 31,000 patients in 2022. Absolutely an amazing number. Talk about that. Talk about your staff and that care. I mean, that's a big number.
Well, we are fortunate to have an excellent team. Our physicians, our front desk, medical assistants, we have housekeepers. Everybody makes a difference and helps contribute to us being able to serve that many folks.
Sara's daughter works in housekeeping at the
She
center.
does.
Awesome.
Yeah, she was hired during the pandemic when we couldn't find anyone.
Right,
She started out as a temp, and we actually have also another model that has worked really well, where we have housekeepers embedded in each department now.
Okay. Oh, wow.
And they help the turnover of the rooms, so that it helps us be able to make sure that they're getting cleaned, and the medical assistants can be more efficient with the work they need to do. We're really big into practicing to your highest level
I like that.
of ability.
That's awesome.
Yeah.
The center also provides a lot of community service in addition to just the basic services, all of the great things you do. Your staff is very involved in the community.
Yes, they very much so. And I had to bring it because numbers in my head are hard to remember. But this year, our staff have donated close to $3,300 in cash. Donations to many different things in the community. United Way, Interfaith, Community Action Agency. We've donated to ramp it up Very strong partnership now with Partial Girls. We've done that as well. But in addition to that, there's a lot of things that we do that are not the cash piece. So bringing in winter coats and toys for tots. I'm probably missing things, but
We want to do a diaper drive too.
diapers,
Yes.
yep, canned food drives. We've done those as well. So.
And Doctor, you see firsthand, what this community needs outside of, healthcare. Again, 31,000 people through that door. The community is in need, and you guys recognize that during this time.
Yes, absolutely, we do. I mean, we see people who come in who, for them, the priority is not the medical care at that
Right.
moment because they have other more important things for them. So it's very important that we take care of their socioeconomic issues too.
And now it's time we've got enrollment advisors that
Yes.
anyone can take advantage of.
Anyone, yeah. You don't have to be a patient of the center. You just call our main number, and you can make an appointment, and a trained navigator will work with you.
That's great.
So we're at the end of, nearly the end of this year.
Yes.
Always growing. It's amazing the growth of the center over the years. What's on the plan
on the
for
docket?
next year?
Yeah. So we are really excited. We also, I didn't mention this earlier, but we just also expanded our services that we offer at Lifeways. We have a primary care clinic there, and we have been going 1 day a week, and we're working up to 3 days a week, and that is services for consumers or patients at Lifeways. So that's an expansion that we are underway in the midst of. And then coming in the next year to 18 months, we're really excited to be able to expand our walk-in. We're going to be putting an addition on our building
Really?
that was built in 2011. We're going to
Oh,
add
wow.
on to our walk-in, and then with that, we're also going to add a drive-through pharmacy.
Oh, wow.
Where we're going to have 2 windows where patients will be able to pick
That
up
will
again.
change things,
Yeah,
certainly.
it will.
Yeah.
We get a lot of asks for that
Yeah.
from the folks that use our pharmacy, so we're really excited about that.
It really makes so much sense. Of anything that should have a drive-in, it's the pharmacy.
For
People
sure.
are coming, they're sick, maybe they're disabled.
Yes.
It's really it's a necessity.
Absolutely.
Good for you guys putting that out. That's amazing.
Yeah, and we are hoping to expand also, we're planning to expand our home delivery. Right now, we do deliver prescriptions to individuals. Because of our staffing and our limitations there, we aren't able to open it broadly. So our focus right now is really folks who are maybe either homebound or more challenged to get out of the home, transportation issues, those kinds of things. But about 25 to 30 patients a week we deliver
Wow.
their prescriptions.
Before the show, we're talking about how many people you've saved their lives by having the Center for Family Health, and you said, well, it just happened. It does. It's amazing.
Yeah, we
That's gotta
literally
be-
have had that happen.
Yeah.
And it's so great to be here for the community, and our staff is just excellent, and they
Yeah.
just care so much, very compassionate, and want to do the right thing. And
Thanks for all you guys do. Certainly
Yeah.
appreciate it.
And you can still get a flu shot,
You still
COVID shot,
COVID shot.
yes,
any shot. You've got them all.
You've
We've
got,
got
it.
them all.
and we
Got 'em.
definitely can give them when they come in.
Awesome.
absolutely.
Yes.
Just give us a call, and you see the number there, 748-5500.
And I think if you just don't know if the center has services for you, just call and you'll find out. So I think that's the
Absolutely.
easiest thing.
Yeah.
From the Center for Family Health, COO and Interim CEO, Sara Benedetto, and Chief Medical Officer, Dr. Rose Johnson. More of the morning show. Stay tuned.